All right. Hello, everyone. Thanks for joining us today. My name is Lucas Caldwell-McMillan. I'm the managing attorney of the Health and Welfare Unit at Legal Services of Eastern Missouri. And I'm going to be talking about Missouri Medicaid and a few other health insurance options during COVID-19. Before we get started, a couple ground rules. We are here live for a reason. We want to be able to answer your questions. So please, as we go through the presentation, in the comment box, type your questions. I've got two great colleagues, Erlene Bolton with our Connecting Kids to Coverage program and Jamie Rodriguez with our Public Benefits program, who are going to be answering some questions as we go in the comment section. And then I'll pause for some questions throughout the presentation and try to clean up everything at the end if we have time. I've got about 25 minutes of information to talk to you about, which leaves plenty of time for questions. So please, in the comments box, type your questions and we'll try to get to them as we go. Okay, and I also wanted to remind you, I mentioned my wonderful colleagues. I've got tons of folks I work with at Legal Services. We are available for help now, today, working remotely. You can call us and also go online and click the Get Help Now tab to get help with your civil legal aid needs. If you're outside our 21 county service area on the eastern side of the state, I've also put up the website so you can find the legal aid in your area. If you're in Missouri, and just also put down some information about the Family Support Division. The bulk of my presentation is going to be about Medicaid, some of the new changes, some background on Medicaid. And in Missouri, Medicaid is largely administered through the Family Support Division, at least on the eligibility side. And so that's their contact information. The last thing about my organization is we've done a fair amount of these presentations. So please visit, go back to our Facebook page, check out our YouTube channel. There's been some great presentations on unemployment assistance, food stamps, changes to food stamps during COVID-19, a host of things about small businesses, the stimulus checks. So check those out on our YouTube channel or Facebook page, which is available on our website, or of course on Facebook or YouTube. All right, so I mentioned Medicaid a couple of times. The bulk of what I'm going to talk about today is Medicaid, but I'm going to go over Marketplace, which is the insurance through healthcare.gov, as well as a little bit about COBRA, but mostly talking about Medicaid today. So let's jump into Medicaid. I think we might have some Medicaid experts watching, so please feel free in the comment box if you've got some things to add, to share, please put them in the comment box. This is just a brief overview about what is Medicaid. In Missouri, we call it MO Healthnet. It covers lots of things. It's paid for by the federal government and state government. It covers things in schools, extra payments to hospitals, but the stuff I'm talking about today are really the health insurance programs, which include full medical coverage and dental coverage. It also can include transportation to doctor visits, sick visits, checkups, things like that. There's no deductibles for Medicaid, and generally there's no copays or really low copays for all services. So it's very affordable insurance. There have been some changes to what's covered or how it's covered, how Medicaid covers services, almost all positive. And the first big one is, of course, increased access to telehealth. And so MO Healthnet, the state agency that pays providers, has told Medicaid doctors, nurses, behavioral health specialists that they can start doing services over the phone, over video conferencing, whatever works for them. And so if you know someone who's on Medicaid or on Medicaid yourself working with a patient, let them know that there are probably a lot more options through telehealth than there were, let's say, 4 or 5 months ago. The other thing they've done is kind of been a lot more liberal in how they're authorizing services, letting some prior authorizations carry over during COVID-19. So there's just a lot less restrictions right now on authorizing services, recognizing that our health system is still under a lot of strain. And there was some concern early on about, are you going to be able to get to the pharmacy in time to fill a prescription? And so they eased up some of the requirements to kind of wait till you're on your last few pills to get a refill. And now you can refill your prescriptions a lot earlier. And of course, thanks to federal law, there's no co-pays for any COVID-19 testing for Medicaid. You'll notice there's a little new logo there at the bottom. I tried to highlight, particularly for those folks who are watching that are Medicaid experts, I tried to highlight what's new. So you might want to ignore everything else I say. It might be boring, but if you see something new, you might want to pay attention. That's something new during COVID-19 that's just developed in the last couple months. So talk about what Medicaid covers. Here's a layout of how you become eligible for Medicaid and Marketplace. And it can be a little bit of a complicated chart. So I just want to kind of walk through it and start on that lower right-hand side, which is the coverage gap. And so Missouri is a state that didn't expand Medicaid, which means that if you're a childless adult, you will not be eligible for Medicaid unless you qualify for one of the special programs for adults with disabilities or seniors. And I'll talk about those programs in a moment. But for most adults who are childless, they're not going to have a Medicaid program that they're eligible for. And for most parents as well, that's again in that coverage gap there at the bottom right, they're not going to be eligible for Medicaid unless they make under around $5,000 a year for a family of four. So it's around 23% of the federal poverty level. So which means if you're a parent or a childless adult, unless you're very, very low income and a parent, you're not going to be eligible for Medicaid right now because we haven't expanded Medicaid. On the flip side, if we look at the left side of the chart for kids and pregnant women, we have pretty expansive eligibility. And let's get rid of those federal poverty level percentages on the left and talk about, there we go, talk about some actual numbers. These are annual income limits. I mentioned the annual income limit for parents is pretty low, but for kids and pregnant women, for a family of four, that goes up to almost $80,000 a year. So a lot of kids and a lot of people who are pregnant will be eligible for a Medicaid program. And if they're uninsured, should be encouraged to apply as well. While we're talking about kids, I want to point out something that I think a lot of people don't know about Medicaid, which is that you're a kid for Medicaid purposes when you're 18. It's not until your 19-year-old birthday that you are no longer considered a kid, which means if you're 18, you should apply for Medicaid. You'll probably be eligible if you're uninsured. If you're working with kids in the foster care system, got patients, clients, friends, neighbors, nephews, nieces, it's particularly important for those children to understand that they still will be eligible at 18, because oftentimes the way Missouri works in our Medicaid system for foster care kids, they will be cut off of one type of Medicaid at 18 without letting them know that they're eligible based just on being a kid all the way up until they turn 19. So they should get that extra year of kids Medicaid, because if you're 18, you're a kid for Medicaid purposes. While we're talking about foster care kids, I also want to let you know that if individual ages out of the foster care system, so pretty close to their 18-year-old birthday, or they're still 18 and they're still in the foster care system, then they will be eligible for Medicaid up until age 26. And if you've got questions about that, I can talk to you more about that. Put them in the comments box. But that's a special program for kids who age out of the foster care system that are eligible for age 26. I'm going to talk about Marketplace in a moment, but I did, while we have this chart here, just want to point out that there's these gray areas where the Marketplace, the light gray areas where Marketplace will be offering extra help to lower monthly premiums. And that's between 100% and 400% of the federal poverty level, which is around $13,000 a year up to $50,000 a year. That's sort of the sweet spot for getting that help to lower premiums for Marketplace health insurance. I'll talk about Marketplace in a moment, but I just wanted to mention that while we were here. I've helped families with Marketplace insurance that qualified for that extra help, so their premiums were as low as $0, $15 a month, $22 a month. So it can be an affordable option if you're in that sweet spot of 100% to 400% of the federal poverty level. Also, just want to briefly note two other programs. There is a program called Uninsured Women's Services or Uninsured Women's Health that can cover some of those gaps and some of those family planning costs for women. And that's true for women up 200% of the federal poverty level. And then residents in St. Louis City and St. Louis County may also consider the Gateway to Better Health program, which is run through the community health centers. So that is an option in those two counties as well. Okay, I mentioned that childless adults might have one option if they can qualify on the basis of disability or age. There is a special program. You have to be 65 years or older to qualify for that, or meet the disability standard, which means you're permanently and totally disabled. Think of it as really unable to keep up even more than very minimal hours of a job. And that can be a hard standard to meet, but certainly people are eligible for that program. They also have to meet two other criteria. They're going to have to be below 85% of the federal poverty level. That's around $10,000 for an individual a year. And they've got to have kind of all of their resources, bank accounts, retirement accounts, all of those have to be below $4,000 for an individual or $8,000 for a married couple. So that's different. There is no test like that for kids or pregnant women. They don't have any resource limits, but for this special category on the basis of disability or age, you will have to meet that resource test. There is a slightly more complicated program for folks who are above 85%, where they can meet a spend down, which is essentially a monthly premium. And again, if you have more questions about spend down, I'm happy to address that in the Q&A section in a moment. All right, some more new stuff. So this is really an extended coverage within the disability program that's new for COVID-19. You have to meet all of the income and resource tests on the previous slide, and you have to be positive for COVID-19. If you meet that criteria, you'll get 90 days of full coverage. So that doesn't just pay for testing or even necessarily just treatment for COVID-19. It could pay for other services, behavioral health, mental health services. It's full coverage, just like other adults with disabilities get. So you will need to prove that you have a positive test for COVID-19, but that's new as a way to sort of expand at least Medicaid to the population that's positive for COVID-19. So I've talked a lot about what Medicaid offers and what the eligibility criteria. How do you apply? My number one recommendation is, if you can, apply online at mydss.mo.gov. Right now, the local family support division offices who handle eligibility are closed to the public, so you won't be able to go in there and get help applying. If you are pregnant or a kid or a parent in that category, there is an option to apply over the phone, and we'll type that phone number out into the comment section. But even for those people who, if you're deciding between phone and internet, I recommend internet if you have access. Now, if you don't have access to internet and either you don't qualify to apply by the phone because maybe you're qualifying on the basis of disability, you can submit a paper application. You can do that by calling the Family Support Division call center and asking for them to mail you a paper application. You can complete it and mail it back. So while not ideal for those people who don't have easy access to internet, that's probably their only option at this point, because the local offices are all still closed to the public. Bottom line, if you can, apply online. And if you need assistance applying, our Connecting Kids to Coverage program helps families apply for Medicaid. So please call us if you want help getting your application processed and approved, completed. We can do all of that remotely, so please give us a call. So when you're applying, what are some things that you need to have? So you'll need to prove citizenship through a birth certificate, maybe some other identity documents. They'll want social security numbers for all applicants. And I'm saying applicants like that to emphasize it's just if you're applying for coverage. And so if you're a mom applying for your son and daughter, you'll need to supply the social security number for your kids, but you don't need to supply your own. If you have one, I would recommend putting it on the application. It might help process the application more quickly, but it's not a requirement. If you're an immigrant, they're going to ask you for supporting documents about your status to prove that you qualify based on immigration status. So copies of green cards, alien numbers, things like that. Two new things to point out. One is that you normally are required to submit sometimes a fair amount of income documents, copies of pay stubs, letters from employers, things like that. But the Family Support Division has, during this COVID-19 period, relaxed that requirement, and now they're allowing self-attestation. So what does that mean, self-attestation? It really just means they're going to take your word for it. And so if you maybe lost your job and don't have any more income, and you need to prove that you don't have any income right now during COVID-19, you can take out a piece of paper, write down, I, Lucas Caldwell-McMillan, worked at Acme Incorporated until March 20th. My last paycheck was April 1st. I currently do not have any income. Sign it, write your full name, and you can send that in. The other thing you should put on any document that you're sending to Family Support Division is your Social Security number and date of birth. And that's so it can get connected up to the case. If you just put your name down, there's a very good chance that it will never get connected to your case and your application will be delayed. So I really recommend putting that down. And you can now send documents through their secure email system at that email address or fax them. And so I would recommend those two options. I mentioned that the local offices are closed. Some of the local offices have outside what are called drop boxes, essentially a mailbox for the public to drop things off in. Some offices still are checking those and those are still open. So that could be an option for you, but it's much more secure and easy if you have access to email or fax to send in supporting documentation and applications through that system. So that's a new change that they're now accepting kind of supporting documents through email and fax. All right, a couple other changes, two good, one bad. One is that they're not closing anyone's Medicaid case during this period, at least through the end of May. And so all Medicaid coverage will stay open. Up until this morning, I would have told you that for as far as we know, coverage is staying open. I did get a call from a social worker at a hospital this morning saying they've seen kids being cut off. I don't have any more details on that. All I would say is please, 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 if you hear anyone getting cut off of Medicaid during this time, have them call us immediately. We'd want to alert the state and help them through that. Everyone's Medicaid should stay open by law. And so give us a call if anyone's having problems like that in your life. They've also pushed off the annual reviews. And so as a part of Medicaid, every year you'll need to go through a recertification process, fill out some more forms, maybe send in some more documents. Any of those annual reviews for March, April, and May of this year have been pushed off. And so they'll be pushed off into 2021. So essentially skip a year of annual reviews for those individuals. I think there's a chance that'll happen in June. They haven't announced that yet. I think there's a chance that'll happen in June, but for now it's just March, April, and May annual reviews are pushed off. And now we get to these bad news for applications for individuals with disabilities. So if you're applying for the disability category, typically what would have happened is the Family Support Division would have gotten your application and gathered up some medical records, looked at the medical records and decided, do we have enough information to decide if you meet the disability standard or not? If they didn't have enough information, they would order an outside exam by a doctor, a physical or mental exam, depending on your conditions, or maybe both. And then that doctor would write a report, send to the Family Support Division, and then they'd look at the report and your medical records and make a decision based on that. Well, right now, due to COVID-19, there are some delays in getting those outside exams. And so that can delay an application on the basis of disability pretty substantially at this point. Now, as things open up, the expectation is it'll be easier to get those outside exams, but right now I still think you'd expect a delay. What that means practically is if you're applying on the basis of disability, do your best to submit as many medical records as you can with your application and have your doctor, nurse, social worker, clinic office manager who's helping you, have them do their best to also submit as many medical records, because the more evidence they have, hopefully they'll be able to reach a decision without ordering this outside exam. That's always best practice, but it's really important during this time because of the unavailability of those outside doctors. All right, well, I've mentioned a couple of times the offices are closed. I guess that's the bad news. The good news is they have extended their call center hours. And so we'll have my colleagues punch in the call center numbers on that first slide, but that should be in the comments section. It's open on weekends now and a little earlier and a little later. So they have extended their hours. The Family Support Division has told us that the call center has greatly improved, and the average hold time is around 1 minute to get to someone, and they're not deflecting any calls. If you can do me a favor, if you've had either a positive or negative experience with the Family Support Division call center, please let us know in the comments. I'm hoping to hear good news. We've heard from the state that it's they really, because they've pushed off some of those annual reviews and other things, they have more staff to answer the phone now. And so they're able to take the calls. But let us know in the comments. And if you're having real trouble and can't get your benefits because you can't get through, of course, call us to see if we can help you get that resolved with the Family Support Division. The other good piece I will say is, although their offices are closed to the public, the staff's still working. And in fact, right now, what they say is some of the application processing times, the amount of time it takes to approve an application is some of the shortest time ever. And so maybe a good time to apply as long as you can get that application in through online methods or other methods, because they've pushed off some of the work and they're considered essential workers. So they're all still working to process applications. All right, let me stop there and take any questions you might have about Medicaid. I guess one of the questions we get often is about Medicaid managed care. And so in Missouri, if you're a child or a pregnant woman or eligible on the basis of pregnancy, you will have the option to enroll in one of 3 managed care plans. Those are Home State Health, Missouri Care, and United Healthcare. And so after you become eligible, you'll get instructions from the MO Healthnet division about how to select either online or via phone which of those plans that you choose. Now, often the follow-up question we get is, how do you choose? All the benefits are the same between the 3 plans. So what you want to do is check with your doctor or your kid's dentist or therapist, the providers that you're working with, and ask them, or you maybe want to establish a relationship with if you're newly eligible, and ask them, which of the plans do you accept? Because the networks and which doctors and providers are in the network is the biggest difference between the plans. So I would start there in making a decision to do it. Another question about we didn't get into a lot of this. Let's go back to our chart here, but about the CHIP program, which if you go back to our chart, if you look at the left-hand side, those are those dollar amounts. Those are the higher income levels do have a premium for the MO Healthnet program through CHIP. It's the same coverage as Medicaid. You will have a premium amount. The good news during COVID-19 is they're not closing any cases for missing a monthly premium amount. So if you miss a payment to MO Healthnet, the case will stay, your kid's coverage will still stay open. So that's another good thing that they're doing during this COVID-19 period. All right, well, let's see if we've got any other questions here. Okay, seeing none, I'll keep going and then we'll catch them up here at the end. So I've talked a lot about Medicaid. I want to switch over to marketplace health insurance, which is another option you might have if you're uninsured right now. I mentioned that this is private health insurance. You purchase it through healthcare.gov or through the federal website or exchange. And for people between 100% and 400%, they're going to get extra help lowering the cost of premiums. There also are some extra help to lower things like copays and deductibles, because like other private health insurance and many employer-based insurance, marketplace insurance will have copays. Those are payments you make per visit, a $10 copay to fill a prescription or a $20 copay to visit the doctor. and deductibles that you have to meet like other private insurance. It does include all preventative medical services for free. So checkups, vaccinations, things like that are all covered for free. Other services may have copays and deductibles. If you apply for this online or on the phone for that matter, you can comparison shop and find out what combination of network and copays and deductibles work best for you. And there is a great network of help throughout the state of Missouri at covermissouri.org. And so if you want someone to walk you through that marketplace health insurance and compare options with you, I encourage you to connect up with them. How do you enroll? Well, normally marketplace insurance is only available during open enrollment, which this year is November 1st to December 15th. Because we're part of the federal exchange, there's no special coronavirus COVID-19 special enrollment period. But there are other special enrollment periods to consider. The big one is if you're recently lost employer coverage. So you may have lost your job due to COVID-19 or for other reasons and lost employer coverage. You'll have a 60-day special enrollment period from when you lost employer coverage. So if you're working with someone, you've got friends, families, neighbors that have recently lost employer coverage, they're going to want to go in the next month or so to make sure they, within 60 days of losing that coverage, go in and shop around and find out if marketplace health insurance works for them, because they're going to be able to select a plan during this special enrollment period. The other special enrollment period to consider during COVID-19 is moving out of the Medicaid gap. This is for people who maybe were pretty low income workers who were earning below the poverty line, but due to the increase in unemployment benefits may have moved above the poverty line. If that's the case, they'll have moved out of the Medicaid gap and they will have a special enrollment period to select a marketplace plan. They should ask for the Medicaid gap special enrollment period, and they should be eligible for that as long as their income has put them now above the poverty line. And as you may have already guessed, how do you find marketplace health insurance? You go to the federal website, healthcare.gov. Always good to remember that .gov part. There are other private businesses trying to profit off of the healthcare market, but you need to go to healthcare.gov, G-O-V. And they also have a call center, and you can do the entire application and enroll in health insurance over the phone at the phone number listed. So that's how you would enroll in marketplace health insurance as you're looking for health insurance options during COVID-19. Got one more to talk about, and that's COBRA. This would be for someone who's lost employer coverage, because this is an option for some people who lose employer coverage to continue it up for 18 months after they lose their job. They're going to receive a letter from their health plan administrator with instructions on how to select that. And it will be, depending on the plan, there will be a cost. That's not free. But the one thing to consider when thinking about COBRA is whether you've already met your deductible or out-of-pocket maximum for your work plan. Because if you have, it might be a lot more affordable to continue to pay for that than to select another plan, which might have a new deductible or new out-of-pocket maximum. So when looking at COBRA, that's an important consideration, along with what other options you're eligible for, like Medicaid or Marketplace. Okay, those are the three options I wanted to talk about today. Let me just make sure there are no more questions. And then I'll just mention that we should be able to help you with your Medicaid needs here at Legal Services of Eastern Missouri. So please go to our website, click on the Get Help Now tab. We help if you're being denied Medicaid, help with applications for kids and pregnant women and families. We help with all sorts of managed care issues through our Advocates for Family Health program. So please reach out to us. We're open for business. And I'll just check in. I don't see any further questions. Okay, well, thank you all for participating, and stay safe and have a good rest of your day.